All right, let's talk about one of the biggest, most intimidating sections on the entire NCLEX, management of care. If you've ever looked at this topic and felt completely overwhelmed, trust me, you are not alone. But we're going to break it down step by step. Let's dive in.
So, I want you to look at this number, 21%. Now, this isn't just some random statistic I pulled out of thin air. According to the people who actually write the test, the NCSBN, this is how much of your NCLEX-RN exam this one single category can make up. That is a massive chunk of your final score.
Yep, up to a fifth of your whole exam comes down to this. It's the section that's not just testing what you know, but really how you think and how you make decisions as a nurse. It's definitely high stakes, I get it, but don't worry, we are going to break it all down into pieces you can actually handle.
So how in the world do you tackle a section this huge? Well, you start by looking at the blueprint. The absolute first step to mastering management of care is to understand what the test creators are even looking for. You got to go straight to the source, and that's the NCLEX test plan itself.
And when you look at that plan, you see that this giant topic really boils down to four main ideas. Think of them as the four pillars holding everything up. You've got delegation and supervision, prioritization and assignment, legal and ethical stuff, and finally, resource management. Let's take a closer look at each one.
First up, delegation. This is all about knowing which tasks you can safely hand off to other team members, like LPNs or nursing assistants. But here's the key word you can't forget: accountability. The NCLEX wants to know that you understand that even when you delegate a task, the ultimate responsibility for that patient, well, that still lands squarely on your shoulders.
And to delegate safely, you have to live and breathe the 5 rights of delegation. Is it the right task, the right circumstance, the right person? Are you giving the right direction? And are you providing the right supervision? I mean, think about it. You can't ask a UAP to administer an IV push, right? That's the wrong task. You probably wouldn't ask them to get vital signs on a patient who's actively crashing either. Wrong circumstance. The NCLEX will build tricky scenarios around this framework, so you have to know it inside and out.
Okay, let's talk about pillar number 2, prioritization. This is that classic NCLEX question, right? You've got 4, maybe 5 patients, all needing something. Who do you go see first? To get these right, you need to rely on your frameworks, like the ABCs, airway, breathing, circulation, and Maslow's hierarchy. The person struggling to breathe always comes before the person asking for a blanket. The test is going to force you to decide, what is the single biggest threat to life right now?
Our third pillar is all about legal and ethical issues. This is where you become the patient's staunchest advocate, and it's also about protecting your own nursing license. We're talking about things like making sure you have informed consent before a procedure, or understanding your absolute duty to report suspected abuse. These questions are really a test of your professional integrity.
And the final piece of the puzzle is resource management. This is the big picture stuff. It's less about one patient's immediate needs and more about the whole system. These are questions about coordinating a discharge with a case manager or knowing your role in a disaster plan. It really connects what you do at the bedside to how the entire hospital or clinic functions.
Okay, so now we have a handle on what's on the test. The big question is, how do you actually study for it? I mean, with all the resources out there, UWorld, Archer, Simple Nursing, you name it, it's so easy to get completely lost. So let's draw out a strategic map.
Think of it like this. Each tool has a specific job. Your question banks, like UWorld or Archer, they're your flight simulator. That's where you get in hundreds of practice wraps, and, this is the most important part, you read every single word of the rationales. Then you have video lectures for those concepts that just won't stick in your brain. Study guides are perfect for that last-minute quick review, and, don't forget about peer support forums. Sometimes you just need to hear from someone else who's been through it.
This thought from a nursing forum just hits the nail on the head. It's not enough to memorize lists. You have to understand the why behind them. Why does this right matter in this specific situation? The rationales in those question banks, that's where the real learning happens from management of care. They teach you how to think, not just what to know.
And all of this brings us to a really, really critical mindset shift. If you want to nail this section, you have to stop thinking like a nursing student who's just trying to memorize facts for a test. You have to start thinking like a charge nurse who's making critical, real-time decisions on the floor.
Just look at this comparison. On the left, you've got a fact. A normal potassium level is 3.5 to 5.0. Okay, great. Nursing school hammered that into your brain. But on the right, that's a management of care question. It assumes you already know the fact. It's testing your judgment. It's not about what the number is. It's about what you do with that number in a complex situation with 3 other patients who also need you. That's the jump your brain has to make.
Here's a way I want you to think about it from now on. Management of care isn't just another subject to study. It's the operating system that runs in the background for everything else you do as a nurse. It's the framework that lets you use all that clinical knowledge you have, but do it safely and effectively.
So, as we start to wrap this up, I want to connect all this pep work to your actual future. Because this isn't just about a test. This is about getting you ready for day one as a registered nurse.
Let's be crystal clear about this. Getting good at delegation and prioritization, it isn't just about picking the right answer on a computer screen. These are the skills that are going to define your entire first year as a nurse. They're what's going to keep your patients safe and what will earn you respect as a real member of the healthcare team.
At the end of the day, every single management of care question is really asking one thing: are you ready for the responsibility that comes with that license? It's not just about managing a to-do list, it's about earning the trust to lead at the bedside. So as you're grinding through those practice questions, just ask yourself, what kind of leader am I going to be?